Medicare's prescription drug coverage went through some major changes in January of 2025. I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and this video I will discuss these changes and things you need to know as you navigate prescription drug coverage and Medicare. First of all, Medicare is unique in that your health insurance and prescription drug coverage are separate from one another. If you sign up with a Medicare supplement plan like a Plan G, that only pertains to your health insurance. It does not include your drug coverage. Medicare views your health insurance and drug coverage separately, which is where Part D enters the picture. Prescription drug coverage, Part D of Medicare, refers to coverage you purchase which helps you for your prescription costs. Part D can be confusing with potentially high out-of-pocket costs depending on what medications you use, and there's a couple of reasons Part D can be so confusing. The first being Part D has 3 different phases built into the plans, which means you could end up paying 3 different copays for the same medication throughout the year. These phases are your deductible phase, your initial coverage phase, and your catastrophic phase. Now, the silver lining to note is there used to be a 4th phase which included the dreaded coverage gap, also known as the donut hole, but as of January 1 of 2025, the coverage gap has been removed from Medicare drug plans, which is a big relief. So before we get into the drug plans and the phases, let's talk about what are tiers. So what are tiers? Insurance companies offering these drug plans use a book called a formulary, which is a list of medications they cover. This formulary also shows what tier a medication falls into. The higher the tier, the more out-of-pocket expense you will have for the medication. So for example, a Tier 1 consists of inexpensive generic medications, while a Tier 4 medication are much more expensive and often brand names. This is an important concept to understand as we look at your out-of-pocket exposure with Part D. Now let's talk about the 3 phases and start with the deductible phase. The maximum deductible any company can have on their drug plan for 2025 is $590. This means you will pay the full cost of your medications until you hit your $590 deductible. Once the deductible is reached, your plan kicks in and helps and your costs go down. Some Part D plans have a lower or even 0 deductible plan, but they come at a higher monthly premium. Most plans which do have a deductible do not require an individual to meet this deductible before they helped with their medication costs if their medications fall into Tiers 1 and 2. So what this means is if your medications that you are using are Tier 1 or 2, typically these are cheaper generic medications, you will pay the same copay in your deductible phase as you would outside of your deductible phase. In short, the deductible would not affect you or your out-of-pocket costs. If you use a medication which is considered Tier 3 or higher, then the deductible will affect you. You will have to pay the full cost of the Tier 3 or higher medication until you've paid off that deductible in full. Once you have paid off your deductible, the insurance company is then going to kick in and begin to help with these higher tiered medications, which means your copay, the price you pay at the pharmacy, is significantly going to decrease. Sometimes individuals who do use expensive medications end up on a Part D drug plan with no deductible, and these plans often do come at a higher premium, but they can be a good option for someone because the higher premium is offset by skipping the deductible phase. Now, the second phase that we're going to discuss is the initial coverage phase. Once you've paid off your deductible and you reach this initial coverage phase, the insurance company is going to pay significantly more for your medications, and you in turn pay less. Your Tier 3 and higher medications are now reduced to a copay rather than paying the full cost to the pharmacy. To reiterate, Tier 1 and 2 medications are often already to little or no copay, and this will not change. Tier 3 and higher medications at this point receive significant help, so your costs are reduced. Many Medicare beneficiaries stay in these first 2 phases all year. For those who are on medications which are Tier 3 or higher and tend to be more expensive, we do have a third and final phase, the catastrophic phase. Though the name sounds pretty, well, catastrophic, it actually helps substantially limit the Medicare beneficiaries' out-of-pocket costs. As of January of 2025, this third and final phase acts as a maximum out-of-pocket. This is insurance talk, which basically means you will have no more out-of-pocket costs for your medications found on your plan's formulary for the rest of the calendar year. You will pay no more than $2,000 a year for medications, which include what you pay for your deductible in the first phase and the copays in the second phase. In the catastrophic phase, the insurance company and Medicare and the drug manufacturers are going to pick up the entire cost of your covered medications for the rest of the calendar year. Now, it is important to note that this maximum out-of-pocket only applies to medications on your plan formulary. You're still responsible for the cost of all medications not on your plan's formulary. You will stay in this catastrophic phase until we reach January 1 of the following year, when we start over again with the deductible phase. What a vicious cycle, right? Now, hopefully, this has been helpful for you in understanding what Medicare drug plans look like and how they operate. Remember, I said there's two things about these drug plans which can make them a little bit confusing. The first is the different phases, which equate to different copays throughout the year. And the second is these plans are moving targets. And what I mean by this is Part D plans do change each year. Every Part D plan offered in your state can change what premium they charge, what medications they cover, how well they cover those medications, and even what pharmacies they work with. Medicare has an annual enrollment period which takes place each year beginning October 15th and lasting through December 7th. This is the time of year you can review your Part D drug plan and decide if you want to keep the plan you currently have or if you'd like to move to a different plan for the coming year. At this point, you probably realize it is extremely important to review your drug plan each year during the annual and election period. Part D is a part of Medicare. You could easily find yourself paying more out of pocket than you should if you do not review your coverage annually, and we can help. The easiest way to find what Part D plan is the best option for you on an annual basis, just call our office, speak to one of our Medicare specialists. We'll plug in each of your medications into our computer, how many milligrams you take, what pharmacy do you work with, and we will run this information through every available drug plan in your area to determine which one will be the lowest out-of-pocket cost for you each given year. We will break down what tier each of your medications fall into, whether you hit the third and final catastrophic coverage phase, and if you do, what month you hit this max out of pocket. Don't try to go at this alone. Allow us to be a free resource for you as you navigate these Part D waters on an annual basis. This is what we do every day, and we're here to help and would be happy to help. I'd also like to mention, if you'd like more information on Medicare and your benefit options, you can go to our website, advisemedicare.net, or call our office at 316-260-3331 to request a free copy of my book, Medicare Made Simple. We'll ship one out to you ASAP. Your health insurance is important, and you want to feel confident in the coverage you have, and we'd be happy to help you navigate these Medicare waters. Now, I hope you found this video helpful, and I really appreciate you watching.